following episode is brought to you by the American Urological Association. This special episode is all about the Focal Therapy Society meeting as part of Endo-Urology Day at the 2025 annual meeting. Keep listening to hear about the agenda and the main clinical areas being highlighted from Dr. Rafael Sanchez-Salas, president of the Focal Therapy Society and one of AUA's top 20 who to follow at the 2025 annual meeting.
Hi, my name is Jay Rahman, and I'm professor of urology at Penn State Health and chair of the AUA's Office of Education. It's my pleasure to welcome you to another one of our episodes in our educational podcast series. And this is one of several episodes where we are really focusing on content that we are going to be sharing at the AUA annual meeting, which is occurring in approximately 3 to 4 weeks. Specifically, this podcast is going to be talking about the Focal Therapy Society meeting at AUA 2025. And it's really my pleasure to host the president of the Focal Therapy Society, Dr. Rafael Sanchez-Salas, and really get a chance to speak with him over the next 20 to 25 minutes about what he thinks is going to be some really exciting content in the annual meeting. And we'll also get an opportunity to pick his brain a little bit on where he sees some of the exciting new developments in focal therapy in the future. So, Rafael, much thanks for joining. Really appreciate your time in advance.
Thank you very much, Ray, for having me. Thank you very much for opening this window of opportunity for the Focal Therapy Society.
Great. So, Rafael, maybe I'll just really broadly start off and just ask you maybe a question that some of our listeners have, which is, what exactly is the Focal Therapy Society? Maybe give us a little bit of a sense of the history of the Focal Therapy Society, what sort of domains you're looking at, and maybe how just urologists and urologic practitioners in general should think about this meeting, this organization, and its implications in sort of the broad scope of urology.
Right. So the Focal Therapy Society was initially a group of pioneers in the field of focal therapy that got together and started to promote this disruptive technological option for the treatment of prostate cancer. This was led at the very beginning by Dr. Polasik and Dr. Jan de la Rosette. They had a meeting on a yearly basis from Amsterdam to the US, and that evolved to become what is the Focal Therapy Society. We officially got to be a society in 2019. And the purpose of the Focal Therapy Society is to not only to promote, but to provide evidence to focal therapy. As we know, focal therapy is, as I said, a disruptive technological option. There's much work to be done in order for focal therapy to enter the standard of care for prostate cancer, but definitely we have turned on the flywheel of focal therapy, and I think it's starting to spin by itself at this point. This is what we have, what we can see at the AUA this year, a number of important sessions addressing focal therapy, addressing indications, treatments, follow-up. So the Focal Therapy Society mission is to provide a high level of evidence and the work needed to establish focal therapy solidly within the standard of care for prostate cancer treatment.
No, that's great, and really helpful to sort of put that into context. Maybe talk a little bit about the AUA 2025. First, maybe just maybe the easy question. When is the Focal Therapy Society meeting this year?
Right. We're looking at a really exciting session that's going to be happening on Monday, April 28th. This is going to be a 2-hour session, and it's the Focal Therapy Society. It will be embedded within the Endo-Urological Society Day. So it's going to be a great gathering of people that are interested in technology, robotics, and obviously focal therapy. We have a clear objective that is to provide a comprehensive overview and the different aspects that are currently happening in the focal therapy in all what it is partial gland ablation for cancer treatment.
So maybe talk to us a little bit more about what are some of the items on the agenda. You're talking a little bit about this concept of partial prostatectomy. Are there any other specific domains that you're going to be covering within the Focal Therapy Society meeting itself that that you think are important for maybe the general audience to know about?
Of course. So Focal Therapy Society is based on accurate selection of patients, and therefore our session is divided in two sub sessions. So the first one is the diagnosis, risk stratification, and imaging integration. This is essential because it provides the necessary variables to properly select patients. So for this, we have prostate cancer diagnosis and stratification in 2025. This is a very important lecture because it sets the stage for focal therapy. And right following, we have interesting presentations on micro ultrasound. As we know, the Optimum trial, it was just published, so it provides a new tool for prostate tissue assessment. We have the integration of imaging within focal therapy, how important is fusion, and bringing this information that you depict on MRI to the OR and integrate it with ultrasound to provide the most accurate treatment. And obviously, we have the integration of AI in focal therapy. That is something that will definitely happen. It's already happening, but it will be established in the upcoming month for sure.
Yeah, I have to say, in your description of the program, I will tell you what I think is really attractive about it is, I think not everybody may obviously be fully immersed in doing focal therapy, but focal therapy, I think, very much is sort of partly an end product of all the things you talked about, which is understanding the disease, understanding the biology of prostate cancer. I think you highlighted some really important concepts of, imaging, which is really, I think the basis of focal therapy is the ability to have visualizable disease that you can treat. And then obviously the focal itself and the focal energy delivery is sort of the end of that. But I think what's so great about the program you described is even for those that may not be doing it, it gets you a lot of the foundational elements so that it becomes, you're walking them through the steps to, I think, somebody that would be more equipped to do that. Was that sort of the goal as you construct some of this programming?
It is. It's exactly our objective. We have this, as mentioned, this first sub session, and then we follow in a second sub session that will depict on energies, especially the long-term experience of cryotherapy that has been strongly developed in the States, and a more recent energy that is IRE, that is actually the third more visited option for focal therapy after HIFU and cryotherapy. And we decided to bring to the program partial prostatectomy, robotic partial prostatectomy, because this is partial gland ablation, and it will be of not importance for the audience to understand that energies are an option, but now we have this option that is a surgically bound option, and this expertise can be explored as well. It was explored in the past, but definitely is more refined, more developed at this point.
I think one of the great things about everything you're saying here is also, I think one of the really nice things of this programming at the annual meeting is that persons can come and they can come to the Focal Therapy Society meeting, absorb everything we talked about, maybe even look at some of the different energy modalities, or even, as you said, partial prostatectomy. But sometimes, even that is a little bit overwhelming. Cryoablation, HIFU, IRE, so on and so forth. But what I really like is different hospitals in different geographies may have different resources available to them. And by being able to do this at the annual meeting, then they then have the opportunity to go over to the exhibit hall and maybe look at some of these technologies. We know a lot of our industry partners are there. And sometimes when you get a sense of the disease and the tools available, then you can go take a deep dive and look at some of these different tools that are actually there in the exhibit hall to figure out what may work with your hospital, your health system, your resources available. So I think that it's always a valuable partnership to be able to translate the academic content into how to functionally sort of apply that into your practice.
Yeah, that is definitely, we want to be a vehicle for focal therapy to be developed in the community, because at this time we have a strong development in the academic institutions, but this at some point we need to go to the community urologists and make them understand that this is possible in any setting. We just need to know how to make technology interact and make the good selection, make the good assessment of risk. This is a risk assessment process, as we repeat every time. And this assessment needs to be done properly to have the best possible outcomes.
Rafael, talk a little bit. We and I know this year you can only put so much on a program, so we've spoken a lot about the program this year. Maybe I have two questions for you. One is, does the Focal Therapy Society, in any of their other programming outside of the annual meeting, does it focus on prostate? Does it delve at all into focal therapies in other organs? For example, kidney. Obviously, kidney tumor ablation would be another version of focal therapy. We just don't, necessarily think about it in the sense of, focal, but we are sort of using energy ablation in renal lesions. And I'm sure you could apply this concepts elsewhere. Does Focal Therapy Society focus exclusively on prostate, or is there some content on other disease processes?
The Focal Therapy Society focuses on both prostate ablation, prostate tissue preservation, as well as kidney partial ablation. And we have presentations, not necessarily this year on the FTS meeting, but there are presentations on kidney ablation, on kidney tissue preservation on every program of the Focal Therapy Society, because we know that is rapidly developing.
Mm-hmm.
It has been there for a number of years, but now with the developments we have on partial nephrectomy, it creates a good discussion for the ablative colleagues and the partial nephrectomy colleagues to interact together and to make the right selection for those patients with the small renal masses.
Sure. No, thanks for clarifying. So, and then my other related question is, obviously, as you mentioned, you can only cover so much in a 2-hour meeting at the annual meeting. But maybe to give us a flavor of what else is out there in the realm of focal therapy, maybe what excites you. Not necessarily content that will be covered this year, but just sort of what are some of the things out there that people can look forward to and keep their eye out on?
Right. This is, we could have another podcast on this for focal therapy. We have the arrival of AI to improve MRI reading and MRI selection. That's a really a very exciting field. We have the combination of a multiparametric MRI with PSMA in the actual evaluation of prostatic tissue. We have the combination of energies plus either pinpoint systemic therapy or low dose radiation that is happening in order to improve the current outcomes of focal therapy. So definitely focal therapy is started like, let's say, to make it more vulgar, like putting a grenade inside the prostate and expecting that to do the work. But we understand now that this is more a biology situation because of the multifocal nature of our prostate cancer. Therefore, you need to think about prostatic microenvironment. And this is what is on development now, addressing prostatic microenvironment, improving imaging, and with the main objective of having this risk process assessment to be refined.
And maybe just share with our listeners. So let's say that persons are interested in everything we've talked about here, but they're just not going to be at the AUA, or maybe they're not going to be, they have a conflict on the day that the Focal Therapy Society meeting occurs. You do have programming outside of the annual meeting, right? You have can you just tell us, when does that usually occur, and maybe tell us about the structure? That's, I'm assuming, a longer meeting, not sort of a 2-hour block. Just give us a broad sense of that in case people can't make this, but they're really interested in being immersed in this field.
Right. Yeah, the Focal Therapy Society is a very active society. We had, in the last September, we have our first joint SIRS FTS meeting. So that combines robotics and focal therapy. We did it for the first time. It was a great success. We were very happy with this symbiosis of societies. And on the top of that, we have a master class that is happening on a yearly basis. In fact, we're having the master class this year, the end of this week in London at the Imperial College. This is a master class that is very well known. So we call it like the one and only master class. Is really perhaps the epicenter of focal therapy happening in London. And so we're bringing the Focal Therapy Society and the Imperial College together to perform this master class this year. We had an excellent master class in Singapore last year during the summer, and our next master class is going to be in Japan next year. But before that happened, we have the World Congress of Endourology that will host the joint meeting from the SIRS and Focal Therapy Society that's going to happen in Phoenix this upcoming September. So we're going to have a full 2 days of focal therapy and robotics, imaging technology together within the World Congress of Endourology. So it's a very active society. We're trying to not only do meetings, but participate on projects. We have a very important prospective registry for focal therapy that is open to everybody, and it will bring real world data on the table. We have done some publications with this registry, but we're just looking forward to make it more solid and to expand focal therapy. There's a number of good design trials that have been published, and we have more trials coming up. So it's a really exciting field and a really exciting time for focal therapy nowadays.
Great. No, thank you so much. That's really super. Any final messages? I think you summarized it quite well there. Is there anything else that you had sort of a final message for our listeners and our viewers?
Right. For us, we've been writing this on social media in the last couple of days. What happens in Vegas will not stay in Vegas this time at AUA2025. We're trying to make a buzz with focal therapy. There are plenary sessions, courses, counterpoints. We have the Focal Therapy Society Day. So focal therapy was brought to the center stage at the AUA 2025, and this is what we want to transmit. And this information will not stay in Vegas. We need to make it global.
Well, Rafael, thank you so much. I think you summarized very well not only what's at the annual meeting, but I really appreciate that you sort of laid out what else is out there, because I do think that it really shows that the content is not compartmentalized into a single 2-hour session that occurs once a year, but you really highlighted how much independent programming there is. So hopefully our listeners will use the AUA as a springboard to get involved and get immersed in the field, but there's lots of opportunities. I want to mention that Dr. Sanchez-Salas was recently announced as one of the top 20 who to follow. So I don't know how you got on that list, but you are on the list, top 20 who to follow at AUA 2025. So you can certainly follow him on Twitter or X at @rsanchez_Salas. And for more information, please visit us at auanet.org/university. Rafael, many thanks for your time again. I look forward to seeing you in person in a few weeks. And really congratulations on leading a very successful year as president of the Focal Therapy Society.
Thank you so much, Ray. And for everybody, join us in Vegas. It will be a great ride. Thank you.